Hi, welcome back, folks. I'm Dr. Danny Angerbauer, and today we are doing part 2 on optimizing sleep. So today is all about once you have got the lifestyle and the sleep hygiene pieces all down, if you're still having issues or you want to further optimize, what do you do next? So let's start out talking about what is the first line treatment for insomnia. So we need to just define a couple things there. So insomnia means trouble getting to sleep, waking up too much during the night, or trouble waking up too early. So any of those things basically constitutes insomnia. And when we say what is the first line treatment for that, that means what treatment has the most scientific evidence for insomnia. And the first line treatment of all the supplements, all the medications, Ambien, everything you can think of is actually something called cognitive behavioral therapy for insomnia. It's not a drug or a supplement. This is just talk therapy where you meet with a counselor. It's a specific type of training, and it's something that usually only lasts like 6 to 8 sessions. So you meet, once a week for like 2 months, and it helps work through how to kind of think about sleep and how to reframe your thoughts, and that is actually the first line. So if you've nailed all the lifestyle and sleep hygiene and are still having some sleep issues, hands down, that is the best bang for your buck. And even just doing 2 months of this therapy has been shown to have long-term beneficial effects. So that's really helpful. Then other things, we're gonna have some more videos on something called neurofeedback, and you can actually train your brain using neurofeedback to relax and calm down a little bit easier. That could potentially be helpful for sleep. And then there's this whole literature on mind-body interventions for sleep, which could be meditation, mindfulness, deep breathing. There's a whole bunch of videos on YouTube where you can, do a guided imagery or, body relaxation practice. There's something called Yoga Nidra. So there's just a whole bunch of things you can look up. And some of those, the evidence is kind of up there, but it does lean towards it being helpful for some people, so that's definitely worth trying. In terms of supplements, the first thing most people think of is melatonin. Melatonin is a hormone that is naturally produced by the body, and it helps with resetting our circadian rhythm. So that's really the instance where melatonin is most helpful if you're, changing time zones and you've been on a long flight and you need to kind of reset for a few days. That's where it's probably the most helpful. In terms of using melatonin every night long term, for years on end, we just don't have a lot of safety data on that. And in general, it's if it's something your body is already producing naturally and you're replacing that, chronically over years, that may not be such a good idea. So melatonin more for kind of short term and, shifting time zones, but there's really a lot better options instead of melatonin. So in performing our kind of literature review, going through our sleep protocols, we found a good meta-analysis, and we talk a little bit more about it on the blog, but the #1 supplement is actually something called L-theanine. And again, this was just from one review article, but L-theanine, it's an amino acid. It comes actually from green tea, which is kind of interesting, but it has kind of a calming effect. It increases alpha waves in the brain. So it helps you to kind of calm down prior to bedtime, and it looks like it improves the quality of sleep as well. There's a number of other supplements that people use that can be helpful. Magnesium, people think of like chamomile tea. There's a compound in there called apigenin, which might be helpful. There's a few other things. We go into more detail on our blog post and give dosages there. But the last thing I want to mention is there is some strains of specific probiotics that influence what's called the gut-brain axis. And so it's just a really fascinating area of research that you can take a bacteria, a probiotic that goes into your gut that then creates chemicals and hormones and neurotransmitters that then go to your brain. And there is some evidence that some specific probiotics can help with mood, with stress and anxiety. We link to one again in the blog post. And is there one specifically for sleep? No, but there probably will be soon. And it's just a really cool area of research to kind of keep your eye on. Finally, let's talk about pharmaceutical medications that are used to treat insomnia. So last year in 2022, there was a big, what's called meta-analysis. So that's a study of studies. They basically look at all of the research that has been published in a systematic way, and then they put together kind of a summary of that. So this meta-analysis showed, it looked at all of the pharmaceuticals for insomnia, and it showed that there's basically no good options. It said that many of the medications that are used for sleep are not effective, meaning it just doesn't work that well. And the ones that do help people have significant side effects, or we just don't know what the long-term safety data is. I think a really good example of this is people have used benzodiazepines like temazepam and its cousin, which is called non-benzodiazepine receptor agonists. That's drugs like Ambien. We've used those for decades to treat insomnia. People have been taking it for a long time, and now there's new research that maybe those increase the risk of dementia. We link to that study in our blog post. So I think that's just a key point to remember, is that we just don't have a lot of good long-term safety data, and there's a lot of side effects. So if you're using a medication for sleep, it's not always a bad thing. There are circumstances where we use it short-term in a specific patient for a specific reason, but you just have to realize that this is a Band-Aid and it probably comes with some side effects, and you really want to get to the root cause in the long run. And I guess the last thing I should mention is there's a new class of medications called DORAs, dual orexin receptor antagonists. And the DORAs, they're kind of just like the classic thing with a new drug. They look pretty effective, the side effects aren't too bad, but they've only been out for 1 year, maybe 2 years for the oldest one. So we just have no clue what that's gonna do long-term in terms of safety. So again, you just wanna get to the root cause, and on a one-on-one personalized conversation with your physician, if you decide to use something short-term, it's best short-term, and try and get to the root of why you're having trouble sleeping. As always, thanks for tuning in today. If you have enjoyed this content, please hit the like button, subscribe, and if you have any questions or comments, just leave a comment in the section below. We'll also have a link there for our blog post, and we'll look forward to more videos and see you next time.